We are here to discuss a very important topic. February, as most of us know, the 4th of February was the Global Cancer Day. But we as clinicians thought that the entire February we'll keep talking about it so that we can bring a lot of awareness into our people about cancer. I have with me Dr. Sandhya Ravi, who is a leading surgical oncologist, has been in this business of managing oncology for a very long time. She is also the managing director of Prameya Health Solutions and also the program director of SAHAI fens. Let me ask her to continue from here onwards. Dr. Sandhya, welcome.
Thank you, Dr. Aftab. Good afternoon, viewers. Today we are going to talk about the importance of supportive care for patients with cancer. And Dr. Aftab, like we all are aware, the incidence of cancer is rising. So there are about 7 lakh new cases diagnosed every year, and it's slated to go up by about 12% by 2025. And we are seeing more and more. Breast cancer has now become the #1 cancer in women. Lung cancer is following close on the heels of breast cancer. Cancer cervix, which was the most common cancer in women earlier, is now moved to place 3. We're also seeing lifestyle related cancers like breast cancer itself could be associated with lifestyle, and also colon cancer. So those things, especially colon cancer, which was very low, incidence was very low in India, is now rising. So lifestyle changes are playing a very important part in the rising incidence, is what we have been noticing in the last few years.
Yeah, Dr. Sandhya, do you think that now that we have all the sophisticated ways of early diagnosis of cancers, this could help people a lot if they are aware of it?
Yes.
So what are the tools we have for early diagnosis of cancers?
Yeah. See, first and foremost, awareness is the key. And like we all know, many cancers detected very early are absolutely curable. For instance, stage 0, stage 1 of breast cancer, any of those testicular cancers, some blood cancers, and some thyroid cancers are all very curable if they are detected early. So awareness is the key. So building awareness, like doing programs around the World Cancer Day, doing programs in October for breast cancer awareness, and year-long screening programs that we can make people aware of, like say early detection for breast is breast self-examination. In a country like ours, it's not feasible to offer everybody mammography. Not everyone can afford that. So teaching them simple breast self-examination, seeing a doctor regularly, knowing your risks. Are you at risk? Your family history, do you have a family history of cancer? Are you obese? Do you have other risk factors? Are you a smoker? All these things, encouraging people to go for an oral examination, stop smoking, do a breast self-examination. All these are educational methods of bringing in awareness. And of course, we have what is called opportunistic screening in our country. We don't have organized screening. So when we say opportunistic screening, when the patient comes to a doctor, the doctor say go and get a mammogram done or a breast ultrasound done. So it's just an opportune moment to do this.
Yeah, it's really good. We have all these latest ways of early diagnosis. But there was one question when I told one of my patients that we can detect cancer early, you can just run a few blood tests. So the question he asked me was, what if it is detected early? My life will be shattered from that day onwards. So I'd rather stay away from it. Yeah, that's a real tough thing to answer back. But nevertheless, thank God we have all these options to early diagnosis and all. So how do you go about this managing people post-diagnosis of cancer? Have you come across any kind of obstacles, problems?
Yeah, so the program that we run is called the SAHAI fens program, and that's to address the unmet supportive care needs. Now when we say unmet supportive care needs, these are, managing side effects of cancer treatment happens in the hospital. People approach their treating doctors. But there are a lot of needs which are not discussed in the hospital setting with the doctor, either because there's no time, hospital OPDs are very busy, or the patients themselves hesitate. They think, is this a matter that I discuss with the doctor? How do I deal with it? So there could be simple issues related to, body image. For instance, a woman who's had her breast removed, or even she's had gynec surgeries where the ovaries are removed, causes a lot. Cancer treatment itself causes a lot of physical changes in the body. Loss of hair, discoloration of the skin. A lady is actually, she's shocked when she looks at herself in the mirror after a few cycles of treatment. So these, not only women, even men face it. So a lot of body image issues, those points are not addressed in the hospital. So they want somebody to talk about. So these are things, this is one aspect of unmet needs. The other could be with relation to diet, simple things of what to eat, what not to eat. On the whole, broadly, your treating doctor may say, bland food, don't have spicy food, eat frequently. But what exactly you need to do, how should you do it? Those are things that a supportive care program can help address. And of course, innumerable emotional issues like, relationship issues, changing roles within the family once you become a patient, addressing how your caregiver will feel. Those are things that are supportive.
Yeah, so which means we have to really have a very holistic approach in managing a cancer patient.
Yes.
Because we'll have to look into the physical therapy part of it, that's one. The occupation, because the guy who is recovering will have to get back to his occupation to look into his livelihood. So occupational therapy, then the psychological management of it. And lastly, and very important, is the economic management.
Yeah.
That once this guy has recovered, the patient has recovered, how will he go about his life and his source of income if he's the only earning member. So luckily here at Sukino, we have a very good team of physiatrists and physiotherapists, and we are doing very well with regards to the physiotherapy management and the psychological management of these patients. Occupational therapy, we have that. So we take a lot of details into managing these people. So how do you address these issues?
Yeah. So like you have rightly said, addressing these different dimensions of care are most important. What we have figured out basically through going through a lot of literature and the research work that was done earlier in this area, not so much in India but in the West, is that we found there are 4 dimensions of care that are important. One is the physical, the functional dimension. It could be related to body image issues, lymphedema in the case of breast cancer patients. It could be pain management and all of that. The second is the emotional, a lot of psychological problems which come. The nutritional problems, a big chunk of it is related to that. How to manage your body weight, how to manage your nutrition. And the last dimension where we found it's very important, probably related to the way they look at life henceforth once they've been diagnosed with cancer, is the spiritual aspect. So how they can connect with themselves to develop a sort of an acceptance, a positive attitude, and get on with life. So what we've seen that because treatment is so vastly improved, patients are living longer, almost near normal lives, after the treatment. So how can they improve the quality of life? That is our focus, and that's how we've identified this functional, emotional, nutritional and spiritual dimensions.
So I think a lot of people, once a member is diagnosed with cancer, they literally lose hope as if everything is gone by. So just for our viewers, I just want to tell you all that I have a couple of cases who have really come out of this fear, and they are willing to lead their lives in a very normal way. I have a single patient with me right now. She was diagnosed with central nervous system lymphoma. Initially, she was at home when she had the first and second cycle of therapy. And then the families found it very, very difficult to take care of her at home because she was not willing to cooperate, not willing to eat. You have all the side effects of chemotherapy. So they brought her to our center at Sukino. So the first thing we did was trying to psychologically help her out of this fear and tell her that hope is always there and you can come out of it. Today she's completed 7 cycles of chemotherapy, and I must say she's doing remarkably well. She's able to eat her food, she's able to walk around with support, and she does smile whenever I walk in and talk to her. She puts up a brave face, smiles a lot, and she's willing to live now with that, that she is almost treated. She has 1 more cycle left. So there's a lot of hope. Don't give up hope. It's not that it's a hopeless scene. And don't have that fear in you. You can continue to lead your normal lives even after diagnosis, even after chemo and radiotherapies. Do you agree with me?
Absolutely, Dr. Aftab. That's the most important point that we need to get across. That it is just, treatment is just one aspect of it. And there is a lot of support and care that is available now for people to reach out with supportive care programs like yours, which are offering, or our SAHAI fens program, where people can actually reach out for so many of these day-to-day simple things which make a great impact on their life. So especially during treatment, it's very disturbing and demoralizing to go through the side effects. But people find a lot of advantage when they participate in these programs or seek help with supportive care groups, where they learn and look at others who've come out of it and get motivated to stay on. So it improves treatment compliance, it improves quality of life, and hopefully survival.
Yeah. I think another important aspect of this therapy and all is when the families that have to be supported. It's not just a patient who's diagnosed with cancer, but the immediate family who's living with them, they suffer from a lot of depression taking care of these patients. So we'll have to address that issue also, and it's being very well done. People are today educated and they understand how to go about things.
Yes. So caregiver burnout is something really an important aspect. We need to look at it. And participating in programs along with the patients. We find that a lot of our patients, when they come into the programs, they come in with the caregivers. So they also learn a lot on how to, deal with the patients, with their problems, and how to address their own needs as well. Yeah. So that's another important aspect of supportive care, which goes a long way.
Yeah. That's really important, because most of the caretakers who stay a long time with these patients can go into a serious breakdown. But we have supportive teams who take care of them. We have regular counseling for the caretakers and the families. Yeah, so it's all a good scenario right now. Unlike maybe about 20, 25, 30 years ago, things have really changed, and people with cancer really need not have their chill run down their spine when you hear of it. There's a lot of hope in this.
There is a lot of hope, and our supportive care groups have found that these women who are part of the group are able to motivate, encourage each other, and stay as a group. They are there to kind of come forward, help others in need, and it's a very positive outlook. And we do these programs every month, where we call it the Joy of Life program, where each person who's dealt with cancer in her own way, his or her own way, comes forward to talk to the viewers about how this is done and motivate them to.
Tell me one or two experiences you have had with cancer patients.
Yeah, especially in this supportive care program. As a doctor, of course, I've been treating patients with breast cancer, especially for the last 30 years. But always, like you said, we see the patients respond differently, right? So more and more, because the cancers are getting diagnosed early now, the patients are living longer, we are looking at improving their quality of life. And so we find that patients are actually enjoying this. It's a new transformation in them. So when they realize that they've got this chance to kind of live life again, they choose to do it in a much better way. So it's a very positive, optimistic outlook, especially when we are interacting with these patients. From a supportive care point of view, it's absolutely wonderful. And they themselves are coming forward to motivate other patients. They're forming a patient advocacy group, which is really nice.
What about the young children? I mean, how many cases of young children have you come across with this?
Yeah, so in my practice, I do not treat young children. And even in our supportive care program, although the mothers or the fathers of children with cancers approach us, that's a different dimension. They have a different setup to deal with their problems. So as of now, our supportive care program does not cater to children with cancer.
Okay, that's great. I mean, that's wonderful. That's good news for most of the audience, who can convey the message far and wide to everybody around, that there is hope and nothing is lost as of now. We can do really well with management of people with cancer. Some questions I think I have for you. So there's one question from a lady named Arpita. So she says that, at what stage can one opt for cancer rehab?
So when you say cancer rehab, it starts right from the time of diagnosis.
Okay.
So somebody who's shattered with the diagnosis of cancer can approach a support group or a rehab center to help with counseling, to help with treatment options and things like that. Mm-hmm. and also through treatment. People who are going through chemotherapy, radiation,
Okay.
just before surgery, soon after surgery. So it really doesn't matter about which stage. It means
Oh, that's
which
great news.
stage
I mean,
of
that means
treatment.
right from day one of the diagnosis, we can start the
Absolutely. Yes, absolutely.
rehab part of it, counseling of it. So there's another person, Diksha Jain, who's asked for what type of cancer can rehab be helpful? I think all types.
Yeah, all types of cancer at all stages, cancer rehab is helpful. When I say this, we shouldn't confuse supportive care with palliative care. We always find that confusion happening all the
Absolutely.
time, right? So palliative care, which typically pertains to end of life care, is not the supportive care that we are talking about. We are talking about supportive care right from the day of diagnosis, what I said. So people, when we say supportive care, if they think it's palliative care, they're saying, why are they talking to me about it? I'm not dying. So the families also think that way. It's not that. It's the kind of support that you need right from day one, from the time of diagnosis. So that's something I think we must convey to the viewers, that supportive care is quite different from the palliative care as it is typically understood.
Okay, that's great. Great news. So one more question there is, can rehab cure cancer?
Yeah, I would say very optimistically.
I hope it could.
Yeah, it contributes to cure. It contributes. I wouldn't say that it is the only factor, but definitely, because there's a lot of research going on now about how emotional issues impact immunity, how simple methods of addressing these issues can improve through yoga, meditation, all those practices, good nutrition, how you can tweak your immunity to actually fight cancer naturally. But at this moment, we are here to say that it is supportive.
Great.
Given along with standard of care is what we promote to help improve your chance of recovery.
Yeah, because the next question, you mentioned yoga, so next question was about yoga. How can yoga help in people with cancer?
Yeah. Yoga helps both physically and emotionally. It helps people calm down, it helps people learn to breathe, it helps people relax, it helps people use their muscles and all to the greatest advantage. It helps people relearn movement, mobility, and things like that.
To end on a lighter note, somebody wants to know, what are the myths about cancer and cure?
There are no myths and cure. I mean, see, no myths about cure. For instance, the word cancer is always like a death knell until recently. But we know now, and media has helped, also celebrities have helped spread the message that it's not the end, right? So associating cancer with death probably is the only myth that we need to bust.
Okay. So is there anything else we like to say?
Just that it's important for everybody to understand that a lot of support is available. We want people to be aware that they can reach out to organizations such as Sukino or Prameya, where especially when you're faced with the diagnosis of cancer, either for yourself or a family member or a friend, and a lot can be done to help you go through this journey and come out much stronger and better.
Oh, that's great. Yeah, it'll be wrong if I did not end this session by saying that COVID is still very much over there, gentlemen. Be careful, be safe, be masked. I know I'm not wearing a mask, but I'm away from my cameraman and my speaker. Don't worry about that. I'm taking good care of myself. And keep social distances. Don't fall into that crazy talk of there's no more COVID, nothing is happening, and have big gatherings. It's very important that we help our government. The government is doing a lot for us. In return, we have to help them back by keeping a safe distance, mask, and sanitizing yourself. Thank you very much, gentlemen.
Thank you, Dr. Aftab.